Implementing STEADI can reduce your older patient's fall risk, and these 3 tasks can get you started.
Falls lead to reduced quality of life, reduced mobility, increased risk of being placed in a nursing home, and many other quality of life consequences for the older adults who fall. So it is very important that we do everything in our power to help our older patients reduce their risk of falling.
By implementing STEADI in your practice, you can reduce falls and you can improve your patient's health and quality of life.
Your efforts count. For every 5,000 healthcare providers who adopt STEADI, over a 5-year period, as many as 6 million patients could be screened. 1 million falls could be prevented, and $3.5 billion in direct medical costs could be saved. Decreasing your patient's fall risk can be as simple as doing these 3 things. Ask patients if they've fallen in the past year, feel unsteady, or worry about falling. Review medications and stop, switch, or reduce the dosage of drugs that increase fall risk. Recommend vitamin D supplements of at least 800 IU per day. Our goal is to help clinicians reduce their patients' chances of falling without disrupting their clinical workflow.
The biggest recommendation I would give to anybody implementing STEADI is to first of all take a close look at the algorithm and find a way that it will fit into your clinician's practices. It helped in my instance that as a physician I was able to do this in my own practice first before I rolled it out to our entire system. And when we went out to other sites to bring them up on STEADI, I could tell them that this does work, it does fit into your clinical workflow, I'm already doing it.
Clinicians have successfully reduced their patients' chances of falling by integrating these actions from STEADI into their practice. You can do the same.
My patients have been very grateful to be part of the STEADI program. Many of them think about falling and are afraid of falling and want to know what their risk of falls are. They also want to know what they can do to reduce their risk of falls. So learning what their true falls risk is and then learning tools and suggestions for how to reduce that risk of falls has been an enormous benefit to my patients, and they really feel like it's given them some concrete advice and things that they can do. And they're seeing results. They feel more confident walking up and down stairs. They feel more confident doing the things that they love to do. They feel much more safe and effective getting out into their community. In addition, I've had many of my provider colleagues tell me that they also have noticed a dramatic difference in their patients' risk for falling. They've felt their patients were more comfortable getting out and doing things. Their patients have become more facile with using gait aids if they need one, getting into community classes, starting vitamin D supplementation, all of those things. So it's really made a big impact both on my own practice and on the practice of my colleagues throughout our clinic. I cannot tell you how many times I've had providers come to me and say, I had no idea how valuable STEADI was going to be for my patient population. It's made such a difference in the lives of my older adults.
Resources to help you implement STEADI into your practice are available in the STEADI Toolkit, on the STEADI website, and from some vendors of electronic health records.
The CDC has developed numerous education materials for patients, all of which are very important and very helpful to provide to patients. We built the patient education materials into our electronic health record so that they would be available on demand to providers from within the clinic room with the patient, and they could be printed out along with the after-visit summary that outlined the steps for that patient's falls plan. A national electronic health record vendor is working on a standardized product to enact STEADI within the electronic health record and make it accessible across its electronic health record distribution.
Under the Resource tab, there are links to all the STEADI materials and the comprehensive course, STEADI, Older Adult Fall Prevention. There is also information about resources that may be useful when conducting a medication review. We encourage you to review these resources and to share them as appropriate with your staff and colleagues. We'd like to acknowledge the clinicians and scientists who provided content for this course. After the conclusion of this course, we would like to ask you a few questions about what you learned. After answering, you will be given information about receiving continuing education. Start protecting your patients today with these 3 easy steps. We thank you for your time and attention as this concludes the course.